Hey everybody, welcome to the FitHealth Pros channel. I am Coach Sean.
I'm Dr. Kevin.
And this is our pain series. Today we're going to be talking about foot pain. Now this is part 3 of foot pain. Interestingly enough, the first ones that we covered the anatomy of the foot, we covered heel pain, ball of the foot, and arch pain. In part 2, it was all toes. Toes are very unstable and they deal with a lot of force and side-to-side movements as well with full body weight and other forces acting upon the foot. So if you did not check it out yet, please go ahead and subscribe to us and like it and ring the bell and all that good stuff that goes along with it, because there's a lot more where that came from. Today, we're in part 3 of foot pain, which is we're going to wrap it up here by talking about yet more conditions, more possible maladies and pain, injuries that cause discomfort and pain in the foot. Now, we're also going to talk about specialists that focus mainly on the feet and the ankles, that whole region there, and what they may be looking for, the types of things that they can do to help heal foot pain, and last but not least, probably the most important thing that we're going to talk about is injury prevention.
Yes.
So why don't we just start talking about other types of foot pain to add on top of the first 2 videos.
All right, we're just going to continue on. The other types of foot pain, let's start with pain in the foot on the outer edge. So last video I kind of went into that a bit as well, but the outer edge is going to be the 5th metatarsal bone. That's the little pinky toe. It's commonly broken. You're going to feel pain. You're going to have swelling. It's going to be bruised. You can take pain relievers. Sometimes you need a walking boot. And again, kind of like I was saying before, if the pain doesn't go away in a few days,
get it checked.
Get it checked, because if it is fractured, it could be fractured farther up into the bone on the upper part of the foot.
Sure.
Yeah, and so there you may need a boot versus just a little tape. And but do the boot if you need the boot, for sure. You're going to rest, ice and elevate it. Don't walk on it. See a doctor for possible casting and surgery. So that's the outer edge of the foot. So another one that I see sometimes, we know some treatment regimens within my office, and it's a nerve condition. It's called neuropathy. So it is nerve damage, most often caused by diabetes. So you might have heard it called diabetic neuropathy. You're going to feel a burning. You're going to have a stinging, an electricity-like or a shock-like sensation. Now it can happen anywhere in the foot. Since we're focused on the foot, it can happen in other places, but we're just talking the foot. Different doctors can set a specific program, because if it's diabetes related, we want to look at it from a diabetic standpoint. Even if it's outside the diabetic realm, you can still have neuropathies. There are some other treatments out there, whether they're electrode therapies, light therapies, nutritional therapies. But from the
a lot of ways to attack it.
Yeah, diabetes, we're talking
knock it down.
Diet there too, diet and exercise.
Right.
The next one is tendonitis of the foot. So we've all had tendonitis somewhere at some point in the foot, and really the foot is is a bad area for everything, right?
It is.
Because
it affects everything.
We're standing on our feet. We're using our feet for propulsion and mobility. So a tendonitis, inflammation and irritation of the tendons, which are going to attach the muscles to the bones, and that runs all along the surface of the foot. So you can have possible pain in different locations. I've just had it recently where it's on the top of the foot, which only affects me when I am barefoot with socks on.
But not barefoot.
But not just barefoot.
Not fully barefoot.
Right. So usually right after the shoes come off.
Okay.
So
just a little swelling, blood flow rushes in.
Right.
Pain.
So it's an interesting thing, because I am on my feet a lot. But for those of you that have that, what you want to do is rest, maybe a pain reliever. I didn't have to take any pain relievers, thank goodness. Usually just getting off the foot, rubbing the foot helped out. But if it is something that is really inflamed, that itis, right, that tendonitis, the tendon's really inflamed, you may need a steroid injection. We've done those here at the office with my medical provider who does the joints, and that works, but we don't do that right out of the gate. We don't want to do that steroid. Surgery is rarely needed for the tendonitis, so that's a good thing.
That's a blessing.
Now, the next type of foot pain is very common, and I see this all through the body. Again, focused on the foot, osteoarthritis of the foot joints. All right, so the cartilage is wearing down. So we're looking at the cause of the problem. What's causing that? Maybe the arches are falling. Maybe there's a pronation or supination causing a wear and tear. Over time, the body's going to go, hey, there's wear there. I need to lay down more calcium. I need to, and that you'll see the bone spurs. So you get pain, you get swelling. There's that deformity in there, not a deformity like a club foot, but what we're talking about is when we look at the x-rays, we see growth there. And I always tell people, I can adjust these joints as long as there's space to be adjusted. If there's a bone spur in the way, we need to send you out, because you can't adjust a little spur that may be poking into a nerve or a tendon and just giving you fits. So that osteoarthritis can cause some problems if left unchecked. So we'll go into what to do. My first thought was just make sure you're preventing those things. Now the last one is athlete's foot, and this is a fungal type of infection that can cause pain because it gets red, it gets swollen, it's irritation, the foot's dry, it's flaky. So what do you want to do? Well, we want to make sure that the foot is washed every day, it's kept dry, and from a preventative standpoint, if it is true athlete's foot, I'm thinking of my kids that played sports. If you're in a place where you share a shower or whatever, make sure that there's footwear to keep, so you're not on the bare floor there.
Right.
That's going to help keep that down. But I think the best thing is going to be making sure that it's washed and dry before the socks are put on. And
Definitely make sure it's dry. The fungi generally love moist environments. So dry those feet.
yeah, that's it. I think it's very common. Everybody knows about it. There's the sprays out there, the powders and things like that. But nobody likes it, and nobody wants to get it from somebody else. So
No.
if you have it,
Sharing is not caring when it comes to
No.
athlete's foot.
all right. So that's the other types.
So those are those types. Now we're going to talk about a few other types, maybe a couple other types, and then go right into specialists. So first type that I want to talk about is rheumatoid arthritis. So in osteoarthritis, it was more of a wear and tear, a breaking down of the joints. This rheumatoid arthritis, which we've talked about in other videos as well, is more of an immune response. So your body is literally attacking itself. Your own immune system is. So there will be inflammation. There could possibly be joint damage just based upon that body attacking itself. Next up would be swollen feet or an edema, sort of a extra water filling up the capsules and the soft tissues in the feet. Now you can get that from prolonged standing. It can be common with varicose veins. Now if you do get that edema, especially if it doesn't kind of self-regulate over a matter of a day or two, you are going to want to see a specialist, because it can be a sign of heart problems, kidney problems, or possible liver problems. So, and in looking at the specialists of the feet, how's that for a little segue there?
Nice.
We're going to go, how about that?
Yeah.
So what they're looking for, these specialists, are kind of your gait, how you're walking, how this foot pain is affecting you, if you're kind of leaning to one side, if you're putting too much pressure on various other joints. They're also going to be looking at specific pain points so they can pinpoint where to take x-rays and possibly palpate the area, just literally touching the area to see how much pressure they can put on it, the amounts of pressure that you can put on your foot, especially if there's a possible fracture. The duration of pain. How long has this pain been going on? Did you go seek help right away, or have you been kind of whistling past the graveyard in this foot pain and it just kept getting worse and worse? Also, possible causes. You know, what did you do? Were you playing a sport? Did you accidentally misstep on uneven ground or off a curb or something like that? And swelling, the amount of swelling, things like that are what these specialists are going to be looking for so that they can get you a diagnosis and get you onto the best form of healing. First and main foot specialist I want to talk about are podiatrists. Now, podiatrists are pretty awesome because they are not just covering the joints themselves, but they're covering the bones, the muscles, the ligaments, and the joints, the skin, the blood vessels, and the nerves in the feet and ankle areas. They are specialists. They went to school to really hyper focus on these areas. So if you have a problem with the foot, if you have a problem with the ankle, that's probably the first place that you should probably go. There are also great orthopedic surgeons that can help as well. You know, they may have experience and training as well in the feet and the ankles, but they also cover the spine and joints throughout the body as well. So they may not have as much expertise fully focused on the feet and the ankles. Now, there are others that can help as well with foot pain. We're talking pain specialists, acupuncturists, reflexologists, chiropractors, physical therapists, and rehabilitative specialists, especially after, say, surgery or rest over time that your podiatrist or other specialists have kind of prescribed, where they can reteach you how to properly walk with a better gait so you're not causing imbalance in the rest of your body. And then we're talking about kind of umbrella remedies when it comes to foot and ankle pain, and that would be R.I.C.E, your rest, ice, compression, elevation, impossible immobilization, depending on just how much pain you're in, how much swelling there is. They may put you in a cast. They may give you a brace or a walking boot. And then if it goes for time where you're still in pain and x-rays maybe have shown a break, they may, or if you have bone spurs or something else of that nature, we're talking about surgery. Now, the most important thing, as we're talking about this foot pain, is if you get pain, please get prompt, appropriate treatment. Don't let it linger over time. We talked about that a little bit on last video as well.
Right, absolutely. Yeah.
It's like get help. Don't try to shake it off. If it's with you for more than a couple or a few days, go ahead and get that checked.
Yeah,
it's worth it.
You don't want it to cause other problems outside of the foot as well.
Right, that kinetic chain. That if the foot is messed up, it could go into the ankle on the opposite foot. It can go into the knee or the lower back or the hips, or right up that kinetic chain.
Right. Awesome. Good.
Good stuff.
So guess what, guys? We get to talk about injury prevention, and
Now's the good stuff.
This is the key. There were so many things in this video, the last part 1 and part 2, where a lot of the remedies were your anti-inflammatories,
right?
Your Advils and Aleve, even steroid shots, things that you just don't want to take over and over and over again. So kind of piggybacking on the pain side of things, we didn't mention some nutrients like the turmeric, like glucosamine, chondroitin, quercetin, bromelain, and enzymes to heal those soft tissues. You can also do that from a preventative standpoint.
Sure.
There's a lot of people that'll get on a calcium and magnesium, even a potassium, to cut down on how much those muscles are tight and make sure that those muscles in the feet are engaging correctly.
And strengthening the bones too.
And yeah, absolutely, yeah, because
it all goes together. They all work together.
as we get older, We always think about the density in the bones, at the large bones.
Sure.
But the smaller bones, the foot and ankle,
Same things happen.
you hear
there.
someone broke something, but they fell first before they broke something, or they broke something before they fell, and sometimes that's in the ankle bones, in the foot bones, or in the hip bones. I think, again, from a preventative standpoint, we want to take it back just to the basics. Let's warm up, making sure you're warmed up before you go for that jog, before you're on your feet all day. Working out, make sure you're warmed up. Walk on the treadmill a little bit and just get those ligaments, those tendons, all those muscles warmed up.
Walk before you run.
Well, yeah. Wow, I've heard that before.
Bam.
Just very basic. This is easy.
Yeah.
Progressive exercising and training. Right? So progressive, we don't want to go from working on the machines to doing high intensity training overnight. We need to take your steps, progress to that point. Allow those support tissues, because you're only as strong as your weakest link. And a lot of people's weakest link are their foot and ankle.
Yep.
And if that is, you go ahead and you push that.
Only so far you can push.
Yeah, you don't want to do that. The other thing is going to be, I have shoes next, but I'm going to talk about walking downhill, since we're kind of talking about mobility and motion. So walking and running downhill, or let's say that you're out on a trip and it seems like whenever we go on vacations, we end up walking like we've never walked before, right? You're just
Right.
like, oh, there's that 2-week vacation in Europe, and
Adding
you put
steps.
like 30 miles in a day, right?
Yeah, what my wife calls a working vacation versus a beach vacation.
Right. And I've had patients tell me, oh my God, it was great. We didn't have to walk too much, but some of these places, they don't have roads and sidewalks like we do. It's so uneven. So be careful when walking on uneven surfaces. When you're going downhill, that can cause a lot of injury due to what they call braking tendencies. So as you're stuttering downhill, you're trying to stop yourself from accelerating, especially if you're older and you don't have much balance.
Right.
Well, you don't want to,
Tumble down.
So you're kind of putting that foot and you're biting in, and it's putting a lot of stress and strain to the ankle, to the toes, to the tendons. And so that, just be cautious of, be careful doing that. So the uneven surfaces and walking downhill, and then it goes back into the proper shoes for your foot. And I can say that
Huge industry.
use a shoe, if you're walking a lot, that's going to take that cushion, but it's supportive. You want to have the right shoe for you from an individual basis, because if your foot's pronated or rotated inward or outward, supinated, which is the inward, pronated outward, whether you have low arches or high arches. So look at that from an individual standpoint. That can make all the difference in the world, from someone that has painful feet all the time to none, or maybe just an elimination to the point where your lifestyle's a lot better.
Yeah, the engineering that's going into these shoes nowadays, especially sport-specific shoes.
Right.
It's a multi-million, even billion-dollar industry for a reason. They put a lot of science, a lot of technology, a lot of engineering into making these shoes to really give your feet the support that they need.
Yeah, they have. I was just reading about the top tier running shoes that cost over $200, $300, and they're putting Kevlar bottoms in there, but then they have a bounce technology that propels the foot, and then the top of the thing is essentially a small piece of cloth that is super lightweight and air breathable, and that would have been a total no-no without the Kevlar, because you needed the hard top to support the foot from rolling over.
Right.
But because the bottom is so supportive now, you can get away with the lighter material. So it's kind of cool, but you don't need to spend $300 for most average people. You can get away with a $50, $60 shoe, but a $10 shoe is terrible.
Yes.
Terrible.
Yes.
So if you're doing sport specific, what else did you want to say?
Make sure to get again, we're talking about specialists for that. There are also specialists for shoes. So they can kind of gauge how your footfall goes, how much pressure is coming down, how much you're weighing, things like that, put it into a software and get you the perfect shoe. Because I know at one point I bought some of those $250 pair of shoes, and I ended up with plantar fasciitis because it was giving me more than I needed.
Yeah.
So, definitely look into one specific for you as an individual, and that will pay you back with foot health, which is priceless.
Mm-hmm. And I've seen, those who need to have a dress shoe for work or dress shoe for church. Man, that's changed too.
Yeah,
so
those got more comfortable too.
You can get away with something that looks traditional, that's comfortable on the inside, or you can do what's called a hybrid shoe. Lower the heel look, or make so there's women's shoes that still have a heel, but then they lift the front of the shoe, so then the overall tilt is not as bad.
Right.
Okay. The other thing you want to do with the shoes is, after you wear them for a little bit, look at the bottom. Look and see what that shoe's telling you. Is it wearing uneven? Is it wearing all on the inside or all on the outside? Is one wearing different than the other? If it is, take that information, whether it's to the foot doctor or to the running specialist or to the shoe specialist, and then address for that. And that will go a long way to prevent all of these pains, all of these symptoms, all of these conditions, and listen to your body. That first bit of discomfort, stop and assess. Look at the big picture, guys, and I think we will have a lot less foot problems for sure.
That's huge. I think out of all these three videos that we put out on foot pain, that injury prevention section that we just did right there, that Dr. Fox just did, may be the most important. Because it's one thing to kind of define what these different pains are. It's another thing totally to be able to say, I don't have to worry about it because I've prevented it. We don't want you to have pain. We would love you to have the information, but we want to keep you out of pain in the first place.
Right.
So, thanks for coming along for the ride with us. This was part 3 of foot pain. Of course, today we talked about other types of pain, even more types of pain, and specialists, and kind of what they're looking for, and the types of specialists that you may be wanting to go see for specific foot pain. And then, of course, this last part on injury prevention. Please, if you got something out of this, please go ahead and like us, ring the bell for some notifications, smash that subscribe button. We'd love to have more subscribers, of course.
Absolutely.
We'd love to be able to help as many people as possible. So tell your friends, tell your family, anybody who could get something out of these. Of course, we covered these today. There are also part 1 and part 2. Talked about toe pain and the anatomy of the foot and other types of pain all throughout the foot. And
very comprehensive.
yeah, we defined quite a bit. And hopefully this helps you. We are the FitHealth Pros. I am Coach Sean.
And I'm Dr. Kevin.
And again, thanks for coming along on the journey. We hope we helped you here, and we hope to help you in the future.
We will see you on the next one. Thanks so much.
Hey everybody, welcome. This is Dr. Fox, who was just looking over his shoulder there. B-roll, instant B-roll, folks. Hey everybody, we're on the Health Pros. That's Dr. Fox, who was looking off over on that side this time.
We'll get this. Take 5.
Oh, 5-minute break, I'll see you then.